In the long arc of human history, there are moments that cleave time in two. Before and after. The discovery of fire, the invention of the wheel, the first message sent across a wire. These were revolutions of the physical world, tools that extended the reach of our hands. But for millennia, one realm remained sovereign, untouched, a universe unto itself, the human mind. Until now. Recently something happened, something so extraordinary it borders on the miraculous. An event so profound that future generations will likely see it as the day our species crossed its final frontier. Not in the cold vacuum of space or the crushing depths of the ocean, but in the silent, intricate landscape of our own consciousness. It began quietly, away from the world's gaze, in a room not unlike this one. The subject was a young man, his body a prison of stillness, unable to move his arms or his legs. For years his world was defined by what he could not do, a mind full of intention, locked within a body that would not obey. On a screen before him, a simple cursor sat motionless, an icon of a digital world he could see but not touch. Then he focused. He thought of moving it. And in that moment of pure will, the impossible happened. The cursor flickered, it trembled, and then it moved, gliding across the screen, guided by nothing but his thoughts. There was no keyboard, no mouse, no voice command, no muscle twitch, no physical movement whatsoever. It was the raw, silent language of the brain, the electrical storm of 100 billion neurons firing in concert, captured, decoded, and translated directly into digital action. A bridge had been built between mind and machine. This is not a scene from science fiction. It is not a special effect from a Hollywood movie. This is documented, peer-reviewed reality. And it happened this year. The technology that made it possible has been developed in stealth for nearly a decade, a quiet and relentless pursuit of a seemingly impossible goal. Today, we pull back the curtain and enter the world where the mind merges with the machine. A world where the human brain, the most complex object in the known universe, becomes programmable, and where the ancient sacred line between biology and technology finally begins to dissolve. This breakthrough promises to restore abilities to those who have lost them, to mend broken connections, and to redefine what it means to be human. But it also opens a Pandora's box of ethical questions we are only just beginning to ask. The company behind this revolution is Neuralink, and this is the story of the moment that changed everything. This is the story of a line being crossed, a boundary between human and machine, once thought to be absolute, quietly dissolving. And it begins with one person. His name is Noland Arbaugh. Before his world changed, he was an adventurer, a young man who embraced life with open arms. At 29, his days were filled with the simple joys of freedom and the promise of a future he was eager to build. He was a man in motion, defined by what he could do, where he could go. Then, in a single, devastating moment, that motion stopped. A freak diving accident severed his connection to his own body, leaving him a quadriplegic. The vibrant, active life he knew was gone, replaced by an unyielding stillness. For 8 long years, he could not move from the shoulders down. His world shrank to the confines of a room, his existence measured by the ticking of a clock and the rhythm of a caregiver's routine. He was a prisoner in his own mind, his thoughts and desires trapped within a body that would no longer obey. Every day was a battle against helplessness, a silent scream for the autonomy he had lost. The frustration was immense, a constant reminder of a life just beyond his reach. He had tried other assistive technologies, but they were clunky, frustrating, and a poor substitute for the fluidity of natural movement. Hope was a dwindling resource, but on the frontiers of science, a radical idea was taking shape. A team of neuroscientists and engineers were asking a question that sounded like science fiction. Could we build a bridge directly to the brain? Could we translate the language of thought into the language of machines? For Nolan, this wasn't an abstract question. It was a lifeline. He volunteered for a pioneering clinical trial, a procedure that had never before been performed on a human. The day came. In a meticulously planned surgery, doctors opened a tiny section of his skull and, with the precision of a robot, implanted a chip smaller than a coin. This device, a brain-computer interface, is a marvel of microengineering. Thinner than a human hair, 64 threads containing over 1,000 electrodes were carefully inserted into the motor cortex, the region of his brain responsible for planning movement. Its purpose was simple, yet profound: to listen, to eavesdrop on the silent electrical whispers of his neurons as they fired with the intention to move. When he woke up, nothing seemed different. The room was the same. The stillness of his body was the same. The world felt unchanged. But in a control room nearby, a team of scientists held their breath, their eyes fixed on a screen. They were waiting for a signal, a flicker of data that would prove the connection was made. Then, something unimaginable happened. They asked him to try, to simply imagine moving the cursor on the screen in front of him. He closed his eyes, focused, and pictured his hand moving a mouse. In his mind, he reached out, and on the screen, the cursor moved. It wasn't a twitch. It wasn't a glitch. It was a smooth, deliberate glide across the digital space, guided by nothing more than his will. In that moment, 8 years of paralysis were bypassed. He played chess, his mind dancing across the board, executing strategies with a speed he hadn't known in nearly a decade. He navigated the internet, exploring the world again. He controlled the computer with a precision and speed that was astonishing. Not with his hands, which remained still in his lap. Not with his voice, for the room was silent. He did it with the pure, unadulterated language of the human brain. The room froze. Seasoned doctors and brilliant engineers stared in disbelief, their faces a mixture of awe and wonder. They were witnessing a miracle of modern science, a moment that would be written into history books. For Nolan, it was more than a scientific breakthrough. It was a resurrection. For the rest of us, it was a sign. Humanity had just crossed a profound threshold, opening a door to a future we are only just beginning to comprehend. Inside the brain, billions of neurons fire at lightning speed. Every movement, every thought, every memory is encoded in patterns of electrical activity. The Neuralink chip listens to those signals. It does not think for you. It does not replace your brain. It simply acts as a bridge, a translator between neurons and machines. 1. Neurons fire. 2. The chip detects the pattern. 3. AI decodes the intention. 4. The computer executes the command A loop of pure mind-to-machine communication. For the first time, the barrier between thought and action has been broken. The world saw the demo, but very few understand the deeper truth. Neuralink did not simply help a man control a cursor. It proved that human intention can be extracted, digitized, and executed. This is the real revolution. Not the cursor, not the game, but the decoding of human intent. This technology opens the door to restoring movement to paralyzed patients, giving vision to the blind, rebuilding damaged neural circuits, treating depression and PTSD, enhancing memory, boosting cognition, and eventually, connecting human minds directly to AI systems. The implications are staggering. Only weeks after the surgery, something unexpected happened. 85% of the electrodes pulled away from Nolan's brain tissue, a potential disaster, a moment where everything could collapse. But something remarkable occurred. The AI adapted, the software recalibrated, and Nolan regained control, even with fewer active electrodes. This single event proved that the future of brain-machine interfaces will rely less on hardware and more on AI. Neuralink survived its own failure and became stronger because of it. While Neuralink commands the spotlight, a silent war is being waged behind closed doors. The race to master the brain-computer interface is not a solo endeavor. It's a new frontier, attracting some of the world's most brilliant minds and billions in investment, each driven by a unique vision for the future of humanity. 3 other companies, in particular, have emerged as formidable contenders, each pioneering a radically different path to connecting with the mind. First, Precision Neuroscience. The company was co-founded by Benjamin Rappaport, a former member of the original Neuralink team. His departure signaled a fundamental disagreement in approach. While Neuralink pursued a strategy of deep brain penetration, Precision charted a less invasive course. Their device, the Layer 7 cortical interface, is an ultra-thin, flexible film, almost like a piece of tape. It's designed to sit directly on the surface of the brain, conforming to its delicate folds, without penetrating the tissue. The procedure to place it is minimally invasive, requiring only a micro slit in the skull. The promise is a dramatic reduction in the risk of tissue damage and inflammation. Second, Synchron. This company's approach is perhaps the most radical of all. Instead of going through the skull, they bypass it entirely. Their device, the stent road, is delivered through the body's natural highways, the blood vessels. Using a procedure familiar to cardiologists, the stent road is guided up through the jugular vein and positioned in a vessel adjacent to the brain's motor cortex. No open brain surgery is required. No portion of the skull is removed. This revolutionary technique allowed Synchron to leapfrog its competitors in the regulatory race. They became the first company to receive FDA approval for human trials of a permanently implanted BCI, a milestone they achieved even before Neuralink. And third, BlackRock Neurotech. If the BCI field has legacy players, it's BlackRock. They are the veterans, with their technology used in research and clinical settings for nearly 2 decades. They have the longest track record of safety and efficacy in humans. Their arrays, while less advanced in form factor than Neuralink's, have already produced breathtaking results. In one landmark study, their implant allowed a man paralyzed by ALS to communicate again, not by typing, but by translating his intended speech directly from his brain signals into text on a screen, powered by a sophisticated AI model. 3 companies, 3 distinct philosophies. Precision's surface film, Synchron's vascular stent, and BlackRock's proven array. Each believes they hold the key to unlocking the brain. Each one argues that their method is the safest, the most scalable, and the most effective. The debate rages on. Is it better to penetrate the brain for high-fidelity signals, or to prioritize safety with less invasive methods? But beneath the technical arguments and corporate strategies, each one knows the truth. This is not merely a technological race to build a better gadget. It is a fundamental race to define the next stage of human existence. If a chip can read your intentions, who owns those intentions? If your thoughts can be decoded by AI, who protects your mental privacy? If companies compete to enhance human intelligence, will the rich become superhuman while the poor remain just human? Neuralink forces us to confront questions that humanity has never faced before. This technology can cure disease, but it can also open the door to brain surveillance, cognitive manipulation, memory editing, weaponized intelligence, behavioral control. The greatest technology ever created may also be the most dangerous. Elon Musk believes that one day humans will communicate without words, thought to thought, mind to mind. Imagine sending a message just by thinking, learning a new language instantly, controlling machines as extensions of your body, sharing memories, saving dreams, enhancing your intelligence. This is the path Neuralink is creating, a path where humans do not use technology. Humans become technology. The world stands divided. Some believe Neuralink is the greatest hope for medicine. Others believe it will destroy human freedom. Some see salvation. Others see doom. But one thing is certain, the human brain will never again be isolated. We have connected our minds to machines. We have digitized human intention. We have opened the door to a new version of ourselves. And now, we must decide what kind of species we want to become. Will we become more human, or something entirely new? Because the future is no longer coming. The future is already inside us.